Hello! So for today's video, I'm going to demo about administering ophthalmic medication or eye drops. So first things first, identify the patient using two identifiers, using their name and their date of birth. After that, check their MAR to confirm the medication that is ordered by the physician. Then after that, perform on hygiene, use your gloves, um, wear clean gloves, then provide privacy and all, and what do you call this, use the seven rights of medication administration to the patient. So right medication, right time, right dose, right um, route. So for the route, we're going to do for the eye or ophthalmic medications. So first things first, have the patient. So he's my dummy patient. His her name. So what is your name, ma'am? Okay, so her name is Mrs. Judy. So Mrs. Judy here. So when are what's your date of birth? Okay, June 6, 1994. So Miss Judy or Mrs. Judy here is our patient born on June 6, 1994. So we have our two identifiers. Then next, position the patient initially in a supine position, laying flat, really flat, not elevated but flat supine. Then next, with the patient on flat, so instruct the patient to look up at the ceiling. So ma'am, we can look up at the ceiling. Okay, very good. Then next, so perform hand hygiene and apply gloves. Then get your medication, so make sure it's not expired and all. So in administering ophthalmic medication, so your medication, or when you hold your medication, it must be on your dominant hand, and the tissue or swab is on the non-dominant hand of the patient to wipe excess medications flowing of the patient's face. So you can hold it, or you can have it have the patient hold it. Sometimes the patient wants to hold it and wipe it themselves, but you can hold it too. So in positioning, so this is the patient's face, this is the hair, this is the forehead, and this is the face of the patient. So with the ophthalmic drop, so with your dominant hand, put your here in the forehead of the patient, holding it like a dart, like that. Then with your what you call this, non-dominant hand with the tissue, put it in here. So for example, this is the part where so this is the forehead facing up, this is the right eye of the patient. So I'm going to administer right eye on the right eye first. So ma'am, I'm going to administer this, ma'am, prescribed by the doctor for your eye infection. So first like that, then what you call this, put drops depending on the prescribed drops of the physician. So put like that and position your tissue in here. So put drops 1 2 3, or 1 2 or 1. After putting drop, the patient blinks for in response to the drops, and instruct beforehand, before putting it, instruct the patient that they feel a burning sensation, a little burning sensation, and it will go away after a few seconds. Then after administering, wipe the excess medication on their cheek or on their hair part, in the temporal part. So wipe it, then repeat to the other side, or repeat in here if necessary or prescribed by the physician. Then after that, have the patient after administering, if they want to close their eyes, it's okay for the patient, for the medication to make kalat on the eye. So after that, after administering, have the patient to a comfortable position. Then that's it. Remove your gloves, dispose any materials used, and that's it for the ophthalmic medication administration. Thank you.